6 stroke symptoms 1 month before it happens. According to a 2024 statistic, every year in the United States, more than 795,000 people suffer a stroke. Out of those, between 140 and 160,000 never return home. That means, on average, every 4 minutes, a family somewhere loses a loved one to this silent killer. These are not just numbers on a page. They represent mothers, fathers, grandparents, neighbors, and friends. And yet, what makes this even more heartbreaking is that in so many cases the body had already been whispering quiet warnings weeks before the stroke ever happened. Today, I want to share with you 6 of those early warning signs. They may look small, almost ordinary, but if you recognize them in time, they can save not only your brain and your memory, but your independence and your life. Everything I am about to share with you is grounded in trusted scientific research, and I have placed the sources in the description so you can see them for yourself. Before we begin, don't forget to like this video, subscribe to the channel, and tap the notification bell so you never miss important health updates that could protect both you and the people you love. Now, let us begin uncover the 6 early warning signs of stroke. The signals your body may already be sending. Pay close attention, because knowing them could save your life or the life of someone you love. And the very first warning sign: sudden, severe headache. Sudden, severe headache is a medical alarm, often caused by blood suddenly irritating the pain-sensitive coverings of the brain and by a rapid rise in pressure inside the skull. When a small, weakened artery on the surface of the brain leaks or ruptures, blood spreads through the subarachnoid space and the pain explodes in seconds, which is why clinicians call it a thunderclap headache. A small leak can produce a brief explosive headache, days or weeks before a major rupture. That early leak is the body's warning flare. In ischemic stroke, where a clot blocks flow, headache is far less common and usually dull or tension-like. In hemorrhagic stroke, where a vessel bursts, sudden severe headache is frequently the very first and most dramatic sign. Other dangerous vascular causes can produce the same lightning bolt pain. A clot in the brain's venous sinuses raises venous pressure and intracranial pressure, driving diffuse or thunderclap pain. A tear in a neck artery inflames the vessel wall and nearby pain fibers, often causing severe one-sided head or neck pain that may come before any weakness or vision loss. In older adults, inflammation of scalp and cranial arteries can provoke new, persistent head pain and threaten vision as well. These mechanisms explain why any brand new, worst-ever headache deserves urgent evaluation. In 2021, John F. Rothrock and Hans Christoph Diener reviewed cerebrovascular headaches and emphasized that aneurysmal subarachnoid hemorrhage classically begins with sudden severe pain, that many devastating bleeds are preceded by a sentinel thunderclap headache, and that early recognition can change outcomes. They also noted that non-contrast head CT performed within the first 6 hours after onset has near-perfect sensitivity for detecting subarachnoid blood, and that a lumbar puncture is essential when the scan is negative, but suspicion remains high. Their review distinguishes ischemic from hemorrhagic stroke as well, showing headache is uncommon in lacunar ischemia, yet prominent in hemorrhage. It also documents that cervical artery dissection may present with severe ipsilateral head or neck pain before any neurological deficit, and that cerebral venous sinus thrombosis often presents with persistent or thunderclap headache and requires rapid diagnosis and treatment. In 2023, Tissa Wayaratne and colleagues synthesized the red flag approach to secondary headaches, highlighting sudden onset, highest intensity pain, new headaches after age 50, and any change in a usual pattern as key danger signs that should trigger urgent workup. For causes such as subarachnoid hemorrhage, venous sinus thrombosis, cervical artery dissection, and giant cell arteritis. They also summarized practical diagnostic pathways and reiterated that early recognition saves lives. Earlier emergency literature underscored the risks of missing subarachnoid hemorrhage and the need for a methodical pathway from CT to lumbar puncture when appropriate, reinforcing why a thunderclap headache must never be dismissed. Here is exactly what to do when this headache strikes. Treat it as an emergency from the first minute. Call for medical help and avoid driving yourself. In the emergency department, ask for immediate non-contrast head CT. Within the first 6 hours, this test very reliably detects subarachnoid bleeding. If the scan is delayed or negative, yet the pain truly began at maximum within seconds, ask your team about a lumbar puncture to look for xanthochromia, because spinal fluid can reveal blood breakdown products that scans may miss later. If bleeding is confirmed, the team will stabilize blood pressure, prevent re-bleeding, and consult neurosurgery to secure a suspected aneurysm. If doctors suspect a venous clot because the headache is persistent, pressure-like, or accompanied by visual changes or seizures, they will order venous imaging and begin anticoagulation when safe. If a neck artery tear is possible because of one-sided head or neck pain, a partial Horner's syndrome or stroke-like symptoms, they will image the carotid and vertebral arteries and start antithrombotic therapy guided by stroke specialists. If scalp tenderness, jaw pain when chewing, vision symptoms, or any new headache after age 60 appear, they will test for giant cell arteritis promptly and start steroids without delay to protect vision. Through all of this, avoid masking the pain with strong painkillers on your own, and avoid blood-thinning over-the-counter medicines unless a clinician advises them, because both can blur the picture or increase risk. The fastest path to safety is rapid transport, rapid imaging, and rapid answers. The rule to remember is simple and protective. Sudden and severe, the worst in your life, and different from anything you have felt before, means go now, not later. That one decision opens the door to the right tests in the right order and to treatments that can prevent a catastrophic bleed or a disabling stroke. Number 2. Visual disturbances. Sudden visual disturbances are one of the clearest and most overlooked warnings of stroke. This is not the gentle blur when you forget your glasses or the tired eyes you feel after reading too long. Stroke-related vision problems arrive suddenly, without warning, and often without pain. What makes them so dangerous is that they are easy to mistake for simple eye trouble, or even just getting older. The science behind this is straightforward. When blood flow to the occipital lobes at the back of the brain is cut off, the eyes may still capture the image, but the brain can no longer process it completely. That is why a person may suddenly lose half of their visual world, called hemianopia. Others lose just a quarter, known as quadrantanopia, or the entire top or bottom half, called altitudinal loss. Imagine looking at a clock and finding that only the numbers on one side exist. In other cases, the eyes can no longer move together, producing double vision, or blind spots open up like dark holes in the scene. These are not eye diseases. They are brain warnings. The consequences reach into daily life. Patients with these disturbances struggle to read, cook, or navigate a busy street. Many experience poor eye-hand coordination and difficulty seeing clearly when the background is busy, problems that raise the risk of falls and accidents. The tragedy is that many patients do not even realize their vision has been cut. The brain fills in the missing pieces, so they carry on unaware that part of their world is gone. Research confirms how common and dangerous this is. In 2022, Vayasundara, Kriyathar, Vayaratne, and Vingris studied 60 people after an acute ischemic stroke and found that 68% had visual loss in the very first week, despite no eye disease before. Almost half of them did not recognize the loss themselves, which meant they were walking, eating, and moving through life with blind spots they could not see. In 2023, Helbo, Edlian, and Cruz systematically reviewed observational studies and showed that almost 30% of stroke patients developed hemianopia, compared to fewer than 5% of stroke mimics. Eye movement disorders were present in up to 37% of true strokes. By contrast, blurred vision without a clear pattern was more common in mimics, such as migraine, appearing in about 22%, compared with only 5% in stroke. This distinction matters because diffuse blurring that comes and goes is less likely stroke, while losing a specific half or quarter of your vision is a classic brain warning. The risk of missing these strokes is high. Posterior circulation strokes, which account for up to 30% of all strokes, often present mainly with visual changes, dizziness, and imbalance. A Finnish study cited in the 2023 review revealed that only 1 in 5 patients with occipital strokes and visual loss reached the hospital within the critical 4.5-hour window for clot-busting therapy, and nearly 1/3 were misdiagnosed at first. Awareness campaigns like FAST have saved many lives, but because they ignore vision problems, thousands of posterior strokes are still overlooked. Experts now recommend BEFAST, adding eyes as a key warning sign alongside face, arm, and speech. Here is the guidance you need. If vision suddenly changes, whether half of the world disappears, double images appear, or blind spots open like curtains being drawn, this is not an eye problem to be left for later. It is a brain emergency. Go to the hospital and get checked immediately. Doctors in the emergency room will check your visual fields, test eye movements, and confirm with brain imaging. Early recognition opens the door to treatments that can restore blood flow and preserve sight. The message is simple. Sudden vision loss, whether partial blindness, double vision, or strange blind spots, is not just aging or weak eyes. It is often the brain's cry for help. Recognizing it quickly and acting without delay can mean the difference between recovery, permanent disability, or loss of independence. Number 3. Excessive fatigue. Excessive fatigue can be one of the earliest and most misunderstood warnings of stroke. This is not the normal tiredness you feel after a long walk or a late night. It is a deep, unshakable exhaustion that arrives even when you have done very little. Some patients describe it as if their body's batteries were suddenly drained. It can appear weeks before a stroke as an early signal, and it can remain after stroke as one of the most disabling symptoms. The science explains why this happens. Normally, the brain dampens the background noise of effort when you move. This process, called sensory attenuation, makes everyday tasks feel easy. But when stroke disrupts these circuits, the filter is lost. Lifting a cup can feel heavy, and walking across a room can feel like climbing a hill. William de Donker in 2021 showed that stroke survivors with high fatigue consistently perceived greater effort than healthy people. And brain stimulation tests revealed abnormal patterns of cortical excitability that matched this sense of constant struggle. His work confirmed that post-stroke fatigue is not simply depression or poor sleep. It is an independent neurological symptom. Many patients even call it an invisible problem because others cannot see it, yet it quietly steals away their independence. Functional studies add more detail. A 2025 review by Soltzoff, Yang, Kim, Keenan, Payne, Jaiwant, and Stilling examined 30 studies and found that fatigue is linked to changes in how brain regions communicate, disruptions in resting state functional connectivity, and an imbalance between the two hemispheres. Between 25 and 85% of stroke survivors experience this exhaustion, and up to 40% say it is the single worst part of recovery. The review also distinguished physical fatigue, the loss of strength and stamina, from cognitive fatigue, the mental exhaustion that makes reading, concentrating, or holding a conversation feel impossible. Fatigue also varies with time. Trait fatigue lingers for months or years, while state fatigue may fluctuate from hour to hour, explaining why some days feel bearable and others impossible. These differences matter for patients and families. Post-stroke fatigue predicts less independence, shorter survival, and greater risk of ending up in assisted care. It is not only a problem after stroke. Managing this symptom requires patience and a combination of strategies. Complete rest often worsens the cycle, so doctors recommend gentle, graded exercise, balanced with planned rest periods. Rehabilitation programs and group activities help rebuild stamina without overwhelming the body. Treating sleep apnea with CPAP, supporting mood with therapy or medication, and addressing pain can all ease fatigue. Some doctors try stimulants such as modafinil, but results are inconsistent. Research into non-invasive brain stimulation, like transcranial direct current stimulation and transcranial magnetic stimulation, has shown mixed but promising early results, suggesting that one day, targeted therapy could reset brain networks involved in energy. Number 4. Persistent high blood pressure. Persistent high blood pressure is one of the most dangerous early signs of stroke, yet it is often ignored because it creeps in silently. Many people see a reading that is just a little high and tell themselves it is nothing to worry about. But when those numbers stay elevated day after day, year after year, they slowly carve away at the brain's blood vessels, setting the stage for both ischemic strokes, where vessels are blocked, and hemorrhagic strokes, where vessels burst. Scientists have shown that what matters most is not just a single blood pressure reading, but the weight of high pressure accumulated over years. In 2020, Chike Nwabuo and colleagues followed more than 3,000 young adults for over 3 decades in the CARDIA study. They discovered that cumulative systolic blood pressure nearly doubled the risk of stroke and heart failure. Even more telling, adding cumulative blood pressure into their models reclassified risk far better than one-time measurements, with a net reclassification index of 0.40. This means looking at years of blood pressure tells the truth about future risk in a way that no single measurement can. The hopeful news is that controlling blood pressure works. In 2022, Kazuo Kitagawa reviewed clinical trials and found that lowering blood pressure reduces the risk of recurrent stroke by 25 to 30%. Intensive control, bringing levels under 130/80, showed even stronger benefits, especially for preventing hemorrhagic stroke. Yet treatment must be individualized. Patients with severe blockages in large brain arteries may need a gentler stepwise approach, keeping levels just under 140/90 to avoid starving fragile brain tissue. Those at higher risk of brain bleeds, on the other hand, often benefit from pushing closer to 120/80. This careful, stepped care lowering prevents sudden drops while still protecting the brain. Evidence from earlier trials makes the point even sharper. The PAT study with indapamide and the PROGRESS study with perindopril showed that reducing systolic blood pressure by as little as 5 to 9 millimeters of mercury lowered the risk of recurrent stroke by 25 to 29%. In other words, even small, steady reductions save lives. Managing pressure during the acute phase of stroke requires extra care. Guo, Liu, and Wang in 2022 explained that in hemorrhagic stroke, quickly bringing systolic pressure below 140 helps stop bleeding from spreading. In ischemic stroke, the relationship is more complex, shaped like a J or U curve. If pressure is too high, brain swelling worsens. If it drops too low, already starved brain tissue is deprived of blood. That is why doctors often keep levels around 150 to 160 in the first hours, unless clot-busting drugs or vessel-opening procedures are used, in which case lower targets around 120 to 130 lead to better recovery. For daily life outside the hospital, the lesson is clear. Persistent high blood pressure is not harmless. It is one of the earliest and most reliable warnings of stroke. Checking your pressure regularly, working with your doctor on a safe target, taking medication as prescribed, and making simple changes, less salt, steady activity, better sleep, less alcohol, can all ease the constant strain on your arteries. Number 5. Difficulty speaking, lisp, difficulty pronouncing. There are two main reasons for this. One is dysarthria, where the muscles of the mouth, lips, and tongue become weak after a stroke, leading to unclear, nasal, or broken speech. The other is aphasia, also called dysphagia, when the stroke damages the brain's language centers. In this case, the problem is not with the muscles, but with the ability to form or understand words. Sometimes both conditions occur together. According to guidance from the National Health Service, NHS, in 2022, dysarthria may worsen when a person is tired or stressed, and it can also cause sudden changes in voice tone or volume. The NHS warns clearly that if unclear speech appears alongside a drooping face or a weak arm, it must be treated as an emergency. Call for help right away, do not wait, and do not try to drive yourself to the hospital. What makes this symptom even more dangerous is that sometimes it comes and goes. In June 2023, the Harvard Heart Letter, reviewed by Dr. Christopher Cannon and Dr. Erica Camargo-Fay at Massachusetts General Hospital, explained that slurred speech may appear briefly in a transient ischemic attack, or TIA. These are often called mini-strokes, but experts now prefer the term warning stroke. The danger is real. 1 in 5 people who experience a TIA will have a full-blown stroke within 3 months, and the risk is highest in the first 48 hours. Even more alarming, imaging studies show that 2 out of 5 people thought to have had a TIA actually already suffered a stroke that was only detected on scans. That is why health organizations emphasize the BEFAST method to recognize stroke: balance, eyes, face, arm, speech, and time. Speech is included because it is one of the easiest signs to notice. If someone suddenly sounds drunk, jumbled, or unable to form words, time is critical. Every minute of delay means more brain cells are lost. For recovery, speech and language therapy is essential. With guided practice and patience, many people gradually regain clearer speech. Progress is often slow, but each new word spoken or phrase formed is proof that the brain is healing. Families play a vital role by listening with patience, encouraging effort, and celebrating every small step forward. The lesson is simple. If speech suddenly changes, if it is slurred, garbled, or words simply will not come, it must be treated as a stroke until proven otherwise. Quick action can protect not just the ability to speak, but also independence, dignity, and life itself. Number 6. Other neurological symptoms. Other neurological symptoms such as sudden dizziness, loss of balance, nausea, vomiting, or brief episodes of memory loss may seem harmless at first glance. Many older adults explain them away as fatigue, dehydration, or just part of aging. Yet doctors warn that these subtle changes are often the brain's first cry for help, sometimes even more dangerous because they are so easily ignored. When blood flow to the brain is briefly disrupted, the systems that control coordination, memory, and balance falter. A person may find themselves swaying to one side, unable to stand steadily, or they may suddenly forget simple details. In medical terms, this can be a transient ischemic attack, or TIA, where symptoms vanish within minutes or hours. Scott Mendelson and Shyam Prabhakaran, in a 2021 review published in JAMA, showed that between 7.5 and 17.4% of patients with TIA go on to have a full stroke within 3 months, with the highest risk in the first 48 hours. They noted that using the ABCD2 score, which accounts for age, blood pressure, clinical features, duration, and diabetes, doctors can identify high-risk patients. Those with a score of 4 or more benefit from dual antiplatelet therapy with aspirin and clopidogrel started within 24 hours and continued for 3 weeks, which reduces the risk of stroke from 7.8% to 5.2%. For others, management may include anticoagulation for atrial fibrillation or carotid revascularization if major neck arteries are narrowed. The challenge is that not every dizzy spell or moment of confusion is a stroke. Brian Buck and colleagues in 2021 reported that as many as half of patients rushed to stroke units turn out to have stroke mimics, such as migraines, seizures, low blood sugar, or ear disorders. These mimics share many of the same symptoms: tingling, slurred speech, sudden imbalance. But they do not involve brain infarction. Treating a mimic as a true stroke can expose patients to unnecessary risks, such as bleeding complications from clot-busting drugs. To reduce mistakes, doctors now use more advanced tools such as MRI, CT perfusion scans, mobile stroke units, even artificial intelligence and EEG to sort out real strokes from mimics. Because of this diagnostic challenge, public health campaigns emphasize the importance of recognition and speed. Traditional FAST, face, arm, speech, time, was expanded to BE FAST to include balance and eyes. Bambang Suryadi in 2024 reviewed studies showing Be Fast is more accurate than fast alone. In 2019, Pickham found both had similar accuracy in general screening, but Chen in 2022 reported Be Fast achieved a diagnostic value of 0.86 compared to 0.76 for FAST. LMR in 2020 confirmed that in hospitalized patients, Be Fast detected strokes with a sensitivity between 83 and 94%. These results prove the value of adding balance and vision to the public's awareness checklist. The urgency is underscored by sobering numbers. According to global health data summarized by Suryadi, every 2 seconds someone in the world suffers a stroke, and every 4 seconds a life is lost to it. That is why experts stress the golden period, the first 4.5 hours. Within this window, clot-busting drugs can restore circulation, and within 24 hours, mechanical thrombectomy can save brain tissue. Beyond this point, damage becomes permanent. The lesson is simple and urgent. If you or someone you love suddenly cannot stand steady, if the world tilts without reason, if memory slips in a way that feels strange, do not ignore it. These may be mimics, but they may also be the start of a stroke. In that moment, it is always safer to act fast, because doing so can preserve balance, memory, independence, and life itself. If the first part of our journey was about recognizing the warning signs of stroke, then the second part is about hope, because stroke is not only treatable, it is largely preventable. In this next section, we will explore the most effective, science-backed strategies to prevent stroke. Some are simple changes you can begin today. Others involve regular medical care, but together they form a strong shield for your brain and your future. Stroke prevention is not only about medicines and hospitals. It begins in the choices we make every day: what we eat, how we move, how we sleep, and how we manage our heart health. And the most encouraging truth is this: more than half of all strokes, perhaps as many as 90%, can be prevented if we act early. One of the most silent and dangerous causes of stroke is atrial fibrillation, an irregular heartbeat that allows blood clots to form and travel to the brain. Many people never feel a thing, which is why it is often discovered only after a devastating stroke. In 2024, Dr. Jeff Healy and colleagues published the Artesia trial in the New England Journal of Medicine. They studied patients with subclinical atrial fibrillation, the kind that is invisible without implanted monitors or wearable ECG devices. The results were clear. Apixaban, a newer blood thinner, reduced the risk of stroke and systemic embolism compared to aspirin. But it came with a cost, more major bleeding events. This balance between protection and risk is exactly why older adults need careful, individualized conversations with their doctors. Building on decades of research, Professor Gregory Lipp and his team reviewed 25 years of progress in atrial fibrillation prevention in Europace in 2023. They highlighted how newer anticoagulants, called NOACs, have replaced the older drug warfarin, making prevention safer and easier. They also introduced a simple but powerful strategy known as the ABC pathway. A. For avoid stroke with anticoagulation. B. For better symptom management. C. For cardiovascular risk and lifestyle management. In the MAFA-2 trial, patients who followed this ABC approach had fewer deaths, strokes, major bleeding, and hospitalizations. Lipp and colleagues also emphasized that for some patients, early rhythm control of atrial fibrillation improves outcomes. And for those who cannot take blood thinners, procedures like left atrial appendage occlusion can provide protection. Beyond the heart, nutrition plays a crucial role. For many years, guidelines suggested that lowering homocysteine with B vitamins did not prevent stroke. But in 2022, Dr. J. David Spence and Dr. Graham Hankey re-examined the evidence in stroke and showed why this conclusion was flawed. Early trials failed because they used cyanocobalamin, a form of vitamin B12 that can actually be harmful in patients with kidney disease, and because many participants were already consuming fortified folic acid in their diet, masking any benefit. Later and better-designed trials told a different story. In the large CSPPT study in China, adding folate reduced the risk of stroke by 24%. In high-risk groups with very high homocysteine, the reduction was as much as 73%. The lesson is especially important for older adults. Vitamin B12 deficiency is extremely common in people over 80, yet often overlooked. Supplementing the right forms, methylcobalamin or hydroxycobalamin, along with folate and B6 can be a safe and powerful shield for the brain. At the community level, global health experts point to even broader solutions. A 2022 review in Lancet Public Health showed that the 5 leading drivers of stroke worldwide are high systolic blood pressure, high body mass index, elevated fasting blood sugar, air pollution, and smoking. From 1990 to 2019, the number of people living with stroke rose by 70%, deaths by 43%, and years lost to disability by 32%. The authors concluded that if countries adopt both population strategies, like reducing salt and sugar, cutting tobacco and alcohol, improving air quality, and promoting physical activity, and personal strategies like polypill therapy, smartphone apps such as the Stroke Riceometer, and support from community health workers, we could prevent 50 to 90% of strokes and cardiovascular events within just 5 years. Even more striking, every $1 invested in prevention yields more than $10 in benefit for society. And yet prevention is not just about statistics. It can be as simple and personal as keeping a blood pressure monitor at home. For many older adults, this small device becomes a lifeline. High blood pressure is the single most important risk factor for stroke, and catching it early can mean the difference between years of independence and sudden disability. Many survivors recall looking back and realizing their numbers had been creeping up silently for years. Checking at home, knowing your numbers, and sharing them with your doctor is one of the easiest, most powerful steps you can take. So what does this mean for you? It means that stroke is not an inevitable part of aging. By protecting your heart rhythm, supplementing wisely, eating fresh foods, managing blood pressure, avoiding tobacco and excess alcohol, staying active, and breathing cleaner air, you are not just lowering your risk, you are reclaiming your future. Stroke prevention is not about fear. It is about freedom, dignity, and the chance to keep living life on your own terms. Thank you for spending this time with me today. I hope these insights have given you not only knowledge, but also hope, that every small step you take can protect your brain, your independence, and your joy in daily life. Remember, it is never too late to care for your health. Each choice you make today builds a stronger tomorrow. I wish you peace, strength, and many healthy years ahead. If this video has been helpful, please give it a like, share it with someone you love, and subscribe so we can continue this journey together.